pressure. Recording's on.
Yay. Sweet.
All right. Welcome to Unboxing Performance. This is episode number 7, and we have our first guest, maybe our last guest, depending on how we do. not you.
Okay. All right.
So our goal today is just talk about motivational interviewing, how it applies to a sports population. We have with us Dr. Ashely Reichert. I have your resume. I could read it, but I think it'd be better if we just had you tell us your story on how you got here and then go from there.
All right. I love it. Thank you guys for having me, first of all. Exciting. I went to University of South Carolina for undergrad, did Duke for grad school, did like a pretty heavy research concentration while I was there with hip stuff. So have like a pretty good, mostly femoroacetabular impingement syndrome type stuff. From Duke, ended up going on to a residency at Texas Health Sports Medicine, and with TCU Athletics. After that, well, I guess kind of while I was there, background, did long-term post-op rehabs for all sports, but spent a lot of on-field coverage and coverage with the team with football and beach volleyball. And then I ended up, after that, I worked for a little while for Texas Health, continued with them. And then about a year and a half ago, I transitioned to a director role at Sanders Fit Rehab and Therapy. So we're a little bit newer of a company, but growing really fast, and essentially just see like a really high level sports and athletic population. So we see anywhere from high school athletes to professional athletes to college kids, and again, a variety of sports, but a lot of basketball and a lot of football. So it's been a pretty cool experience that way with the patients that we have, and then a pretty cool evolution for me personally as well, to grow into a little bit more like business management and operations side of things too.
And you guys just opened a second location, right?
Yeah, we did. So just opened a second location about 6 weeks ago. It's going really well so far, but we have a location. Our first location is inside of Sanders Fit Performance Center in downtown Dallas. And then we just opened in South Lake, Texas, which is about like 30 minutes northwest. So yeah.
Exciting.
Yeah.
I was actually going to follow up. So you're now a director. So on top of doing PT, How many hats are you wearing while working for Sanders Fit?
A lot of hats. I own a lot of hats. I wear a lot of hats. Yeah. It's been fun though. Pretty cool. Again, it's growing pretty fast. So we now there's 3 physical therapists. And honestly, probably are going to bring another one on soon. So exciting.
Cool.
Yeah.
All right. So into the meat of the topic today, motivational interviewing. From the perspective that we're delivered it in, at least at Regis, and it's for shaping those at risk with comorbidities, mindsets on activity.
Mm-hmm.
Although I feel like it's a very easy to just break it down into identifying a patient's why.
Yeah.
How would you define motivational interviewing to you? How do you use it in your practice? And do you use it with every patient? I feel like it's natural if you have a training background, but I'll let you go.
Yeah, no, those are great. I love the background, and that's a great point to bring up. So I guess the first thing that I'll touch on is, do I use it with every patient? I think yes. I think that I use it with every patient. It just depends on the degree with which we use it, right? So I would say mainly you're going to use some people just require a little bit more digging than others. So your subjective naturally, I feel like, is going to touch a little bit on what their why is. I would say overall blanket statement, yes, you use it with everyone. I just think that you have to dig a little bit deeper with certain individuals. So I think my biggest thing that I try to get out of everyone is typically people are seeing you because they're painful, right? But to me, what that individual's definition of success is going to be your ticket. That's what you need from everyone. And I think that's, at least for me, where the motivational interviewing piece comes in, is that I think, and that's mostly what I'm using it for. You kind of want to get to know people and what works for them as well. What's going to, compliance wise, what's going to work for them. Are they someone that needs to be in physical therapy to be doing physical therapy? Are they going to be accountable to do things at home or not? I'm sure you've already seen a little bit of that, or kind of get that with like your personal training background as well, right? Like, are you someone, and people like being honest with you, again, that's like the key piece to reading people a little bit, right? Is like, are they being, because something that you have to consider, I think, is that when people meet you for the first time, like when you meet someone for the first time, are you putting your best foot forward typically? Like,
I think everyone is. Yeah, that's your goal, right? You want to get
yeah,
there.
yeah. So I think that's like a really key important thing that has taken me a little while to pick up on as well. But typically people are going to give you best case. So people are going to be like, yeah, like I could do stuff at home, or I would do stuff at home, or like people are going to try to give you what they think the right answer is. So I think being like really raw with people and just kind of breaking it down and being like, hey, like what is like what do you want to get back to? Like what does success look like for you? That was something that, especially in a more complex patient population, I think is a really important question to ask. And I used to think was uncomfortable. I was like, oh, that feels weird to say it. But now, like, I think that that's something that like you like need to get out of people, is what's your why? Like, what does success look like to you? That's like my favorite question. And then again, kind of like secondary, like, how are you going to get there? So like, is it going to look like that we're in here, we have to be in here 5 days a week? Is it going to look like we have to be in here 3 days a week? Is it going to look like I can give you stuff to do at home and you're going to do it at home? I think that's kind of a key piece. Does that all kind of sound similar to or parallel to like what you guys have learned as well?
Yeah, pretty similar. I think they started with giving us like different models of change, which
Mm-hmm.
if you have your CPT, you know, the trans theoretical model, it's like the base, like everyone gets given this.
Yeah.
And then a few other things like layering it from your personal to your family to interpersonal to occupation, environment, stuff like that. And then, and then strategies of actually how to address it, whether it's recognizing, reinforcing change talk, how to manage resistance when someone's unsure of what you're telling them. It's all traditional relationship building, which is why I think of MI as a buzzword, but also it's totally not.
Yeah.
Like there's definitely levels to it. It's like, yeah, but you would do this with everyone. It's just how deep are you going to go with the patient, which you kind of mentioned too and alluded to.
Yeah, I think that something that's super important on that note is just like being okay with having uncomfortable conversations. Because I think especially as like a new grad PT, it can be kind of intimidating because you're like, oh, like I just want to make the patient happy and whatever. But I think like asking those key questions at the beginning is going to be something that's like you're going to find is really advantageous in your practice, and something that I think, especially when you because people love to, especially private practice therapists, love to claim like we tailor a program specifically to you. So what does that mean? I think that's where motivational interviewing is huge to me, is that, and I think that's what I hope people think that makes my practice different, is that like when people are coming in, you could look at just the diagnosis or just the findings of the exam and give people interventions. Anyone can do that. But I think what is kind of a cool thing to consider is working backwards. So like, hey, if they tell you, for example, like I'm looking to get that, like my knee hurts when I'm cutting, when I'm playing football. That guides to me your functional examination. So like maybe like your table stuff is still going to be the same. Like you're still going to check range of motion. You're going to still check all that low hanging fruit that you typically run through in your exam, but maybe your functional exam is a little bit different. So instead of just looking at walking, looking at squats, looking at single leg balance, single leg squat, well, hey, like it only hurts when they're breaking off that side. So maybe I need to look at something that looks at deceleration or energy absorption or a plyometric, like something that like creates more of that look into a deeper dive of like what to look into. Because then that allows you to go in a different level. Because if you only, for example, didn't do like say that like you didn't do a good job with your subjective, with your motivational interviewing, and you just were like, okay, they have knee pain and it hurts when this, but like they didn't give you like clarity on like necessarily like exactly when it was hurting or during what activity, because you didn't like care to like press to like, oh, what activity was it? um, then that's just going to like essentially like not allow your patient to progress as quickly. So for example, like if you look at a single leg squat looks super great, but then as soon as they go into like a single leg hop or like even like a broad jump or something like that, you notice like a decrease in mechanics or control. um, then now you're able to be like, okay, single leg squats look good, like we don't need to like waste a bunch of time. So say for example, like on your table stuff, like isometric testing, like their knee extension strength like wasn't quite as good. You could like isolate in isolation, just work on like slow controlled knee extension or something that's along those lines, or you could get a little bit of bang for your buck and start them out at a little bit higher of a level, and then also continue to address strength, but maybe do it in a little bit more functional or sport specific manner, which again like builds your rapport with people to then continue to be able to um, almost like continuing to use your interventions as the continued motivational interviewing. So you're able to build your rapport with your patient because they're like, oh, like we're doing stuff that's specifically because I told him that it hurts when I break, when I'm like cutting, when I play football. That to them is going to like build trust, and then they're going to like further elaborate like, oh hey, when I noticed that like when I was at practice today, it felt better during this, but not better during this. And then they're going to slowly like unpack to you maybe like what their warm-up routine looks like, or what this is, or what their typical like habit stack is, or what their typical recovery is. Like that's a pretty cool thing too.
Yeah. I think you bring up some great points on basically how motivational interviewing can basically be an extension of education itself and designing assessments.
Yeah.
I like how you brought up like being more specific with your assessments, like those low hanging fruit of just like NMTs and stuff like that are all like good and said, but to make it essentially meaningful for like the athlete in specific to like have like, okay, we're going to do these cutting assessments and see what actually onsets pain or what's actually causing you pain or any injury, just to essentially elevate their education too, that assessments and things like that aren't so mechanical as we think them to be, and they could be very versatile in that way. And I think with all that, it elevates that level of buy-in that a lot of patients really need, especially like lower tier athletes like high school and stuff like that, not generally intrinsically motivated, some more than others. And it gets really hard to show them that these assessments matter and that we're going to be able to elevate their game. I worked with a lot of high school athletes prior to PT school during my strength training background, and it was like pulling teeth to get them to know that these exercises are going to help them, even though in a short mindset, you can't really see the benefit until it's applied to performance. And I think bringing up all that makes you think of like the optimal theory of giving them some autonomy with what they want to do, finding their why and things like that, and giving them some sort of freedom in like how they want to address things while keeping it sport specific and safe. And bringing up stuff like that, which I really like. And it kind of brings me into like your approach to MI sounds very like free flowing, which I think it should be. And in academics, I think it's very structured in how they teach it. And there's this sort of framework that they want us to keep. So basically, do you think keeping that structure is better than having a free flow, or do you think it should be taken with a grain of salt, the way we learn it, and to find our own kind of style behind it?
I love that question. Okay, so I think I'm a huge believer that structure is going to allow freedom. So I think that if you find a couple, and it takes trial and error, but I think that you mold your motivational interviewing based off of a structure, And then as you get more reps in, and as just like with anything, that structure is going to allow you more freedom. So if you get a really good list, that takes like the like nerves component out of it, that takes the like guesswork out of it. If you continue, so like say like as a new grad, you ask a really specific set, say you like get it down to like 5 questions that you like to ask at initial assessment. I think that you ask those 5 questions. I think you find what works for you. And then you keep those like questions that work for you as your basis of your framework. And then as you start to get more comfortable, you get more reps in, then that allows you to have a little bit of a free flow. And I think it depends on your personality. But like my personality is like quite structured. And so I would say that like for me, like it just gave me like a peace of mind to be able to like really like dive in with people and relax and actually pay attention and listen when I wasn't thinking, because you know that like saying that people talk about where like, I'm gonna butcher this, it's about to be super butchered, but when people say that like, are you listening to listen or are you listening to respond? I think that having that framework of like, you have them written down already, they're on your computer, they're in front of you, 5 specific questions that you know that you're going to ask to patients at the beginning. So like when you're first getting your feet under yourself, there's those 5 that really allow you ask a question and then you just let the patient come back to you, that allows you to connect, that allows you to actually like listen to them. And then once you start to get a flow of that, then you can kind of like start to free flow it a little bit more. And I just think that like connecting with people in general is like a really, really like you said, like that in academia, like we're so focused on and so structured on numbers and objectives. I think objectives are really important. I think objective testing is immeasurably like quite important. I do also think that the connections that you develop with people, especially in your long-term rehabs and getting to know that person, is like really undervalued. But I love that question.
Yeah, those soft skills come in handy for sure.
Yeah, especially when you're, like you said, trying to get like finding what makes people tick. So like even you saying like, so to get buy-in, like in someone that might not be like sure like what they're getting from you or something like that, if you show that you are interested and you show that you care to a high school kid and you find what makes them tick. So like even like for example, like if you like instead of guessing, so instead of saying I bet that this high school football kid, say his name's, I don't know, let's call him Jack, say Jack, you're like, I bet you if I made this into a competition and you tested him on day 1 and this was his number and you told him in 5 sessions we're going to beat that, we're going to double it, is he going to work harder? Probably, but guess what, that's guesswork. If you ask Jack, and again sometimes you're going to, maybe in the high school kids they're not going to know as well, but especially when you start to get into like higher tier athletes, they're going to have a pretty good idea of like what they like and what they don't like. So you being like, hey, like, does competition get you going? Do you like me to motivate you, or do you like me to show you what's negative? Do you like me to focus on the positive? Like all of those are things that are going to really elevate you too. But that's going to make you special. That's going to make you different.
I agree. I think it's a lot of rolling with what the athlete's kind of giving you in terms of that and being able to find their motivational pieces. Like for me personally, I was a rugby, wrestling, and football athlete growing up, and I didn't like people cheering for me, for lack of better terms, or like giving me that like verbal, like you can do it, like come on, or like cheer me on. I like to be very like into myself and just like kind of figuring out where my errors are and then getting feedback prior. But that's one way of thinking for a lot of athletes, and some that just thrive off of that external motivation of like people cheering and like being able to cheer them on and tell them to keep going and make it a competition. And there's some that like the more like numbers behind it to see actual like physical progress of numbers. And I think that kind of goes in with the motivational interviewing, getting to know your patient in that setting a little bit more and finding out their their meaningful like progress and being able to
Yeah.
do that way.
I love that. I love what you said. I think that that's like, and that's a really cool thing that, again, us tying motivational interviewing into sports specifically, it like makes things really cool and like makes it exciting, right? Because if you're a physical therapist that has lots of tools in your toolbox, as far as like, you can, like, obviously we're going to have some degree of numbers involved with things, but if you ask the question, like, do you like me cheering for you? Do you like me giving feedback at the beginning? Do you like me giving you feedback during? Do you like to receive all of your feedback at one time? Do you like video? Do you like to watch yourself? Do you like me to just give you cues? Do you want to see yourself in a mirror? All those are like things that, especially when you start to get like, that's really cool stuff, right? Because like not super talked about, especially in
Yeah.
physical therapy, right? Like that's more so in the side of like skill coaching for sports, right? But
Right.
what if you brought it in? What if you did? Like, is that going to make you like cool? Is that going to get like your patients bought in? Probably. Shows that you care, which is cool. Probably going to get you better results, right?
Yeah,
So
exactly.
I love that you brought that up.
Yeah. And I think one thing I kind of want to like share as some kind of insight I'm starting to have is that you don't have to be a mind reader. Like simply just asking the questions is what will get the job done. Like,
1,000%.
yeah,
Dude,
your
I've been
patient
going through
doesn't.
the same thing with F45 recently. If you've been trying to like modify how I coach, let's just start asking questions. Sorry, back to you. I'm
No, it's
feeling the
good.
same evolution.
Yeah,
Yeah, it's
exactly.
cool, right? Because I think that you think like that you should know best, or like, especially because like we're taught in like as much as we say that we want patients to be involved in their care, oftentimes it still defaults to a model of you being the doctor telling the patient what to do. And like you said earlier, I wanted to circle back to when you said asking the patient like what they want to do next. I love that. That's like something someone gave me feedback on, or like gave me a tip to do that. Probably like maybe like a year and a half ago. And I love it because like say like you have like a post-op ACL and you've been seeing them for a long time. You've been like seeing them for like 5 months already. And you're like, hey, I want quad burnout at the end of this session. I'm going to give you 3 exercises. Which of the 3 do you want to do to finish? Do you want knee extension? Do you want single leg sit to stand? Do you want a wall sit, single leg wall sit? What do you want? And I think that that's like, just like they'll kind of like shake their head at you, but I think that people like to have a little bit of like, instead of just you giving them everything, like for them to be able to like weigh in on it. Like maybe they have an exercise that they hate. Like, you don't know, should ask.
Yeah, and I think it's super valuable because at the same time you're able to still structure to their goals and like being able to give them the most benefit while also giving them choice.
Yeah.
Overall, like I think having choice in what you do, and some patients don't like to have choice. They like to just like come in and almost be mindless, which at that point you can have that conversation with them too to see like, okay, like, do you like to be more independent in what you do and like just have me here to watch and incorporate some educational pieces for you and tell you what's going to help best? Or do you want me to control the whole thing and just walk you through it?
Well, I love that you say that now, like just like still even being in PT school, because it took me a long time to figure that out. Now that's like a common thing. So I'll ask people when I'm trying to get someone a home exercise program, I'll ask. I say, do you want variety? Do you want a program that's different Monday, Tuesday, and Wednesday? Do you want 3 different days? Or do you want the same program that you can knock out, you can memorize it, and you knock it out in 20 minutes every day? And it's funny because you think that you would guess what it is, right? Like you would think like that you could guess based on that person's personality what they want. Different. And it's funny because I'm like shown every day that it's like different than what you would expect. And you can't be a mind reader. Like over communicating is like just like changing the game.
Exactly. I feel like old mindset was like be that mind reader, like be able to predict 5 steps ahead what the patient's going to want when in reality it should be very conversational. The patient should take part in their care, because ultimately you want them to care the most for it. And it's hard to promote rehab if you care more than the patient does, because ultimately like your buy-in isn't going to equate to their buy-in and being able to see what they had in mind.
Correct.
So big things to always, I feel like, consider when dealing with patients for the first time or for an extended period.
Yeah.
You sound so
1,000%.
smart,
Yeah.
Vince.
Huh?
You sound so smart.
No way.
Sounds like you know what you're talking about. Crazy.
I love
I've had
this.
some
I think that
reps.
like I think it's cool though that you guys are already like starting to think this way, like because it just takes a little while like to kind of like get into routine and like find what works for you. But I genuinely think that the more that you can involve, like I think that that's what's going to make you like an elite provider of care. I think that like you really taking other people's, like your patients ideas, your patient's goals, your patient's mindset, because everyone's not the same. And like, just the same as like, if you equate it physically to like what we do from a physical therapy standpoint, is like not everybody's body is going to respond the same way to specific intervention. Even if you say like manual intervention or therapeutic exercise or whatever it is, the same is true for when you're coaching and when you're cueing, and taking that like coaching mindset. People like that, like it's cool, like it gives you a different dimension. Like people will give you that feedback that like it's going to give you a different element, a different edge, if you will, I would say.
Mm-hmm. Yeah, being able to be a coach and a PT at the same time, essentially. And kind of to that point, I feel like a lot of people kind of like isolate those two, that they're not as conjunctive as we think, when in reality, like you can be a coach. Like you don't have to be, they don't have to be in two different boxes, essentially.
No, 1,000%,
And
because it's both. In my opinion, I think it's both. And I think that like it's like a really cool thing to be able to bridge the two. And I think that it's mutualism. I think that it's classic mutualism of your motivational interviewing and your people skills and your coaching skills to be able to get more of what you want from a goal basis. Like I think that you're going to be able to reach your goals faster and more efficiently if you leverage your people skills, if you leverage your coaching skills. I think that you're going to get outcomes that you want faster. And people like that. People like fast.
right, everyone's in for the next quick thing.
Yeah, and it doesn't have to be like, I'm definitely like kind of joking in that realm, but like it's just like a thing. Like if you show, like you showing that you care and you showing that like buy-in of like, we're going to tailor this specifically to you, like it's different to say it versus to like practice it every day. It's cool.
Yeah,
Right.
I agree.
Yeah, that was going okay. I just want to say, like, this has been an awesome flow. I didn't know how I was going to go to have an interview, but I feel like this is like exactly what I would
no,
throw
we
on
have
in the
a
car
good
listening to the
flow. We
podcast.
have a good
This
flow.
is going really smooth. So props to both of you. Vince, did you want to talk about that one session that you went to?
I do.
About injury, as I figured I don't want to take all your time. I figured you have patients to see this afternoon, so I want to get this in before.
For sure.
I'll let you go, Vince. Sorry.
All right. So obviously we kind of met during CSM, and that's kind of the background I had with you. And during the time, I had the privilege of attending a session on the first day talking about mental toughness by Jessica Jones and Jessica Hohen and Mitchell Selhorst. I don't know if you attended it. It was all post-injury on mental toughness in terms of recovery and being able to incorporate self-perception with physical ability and ability to recover. And obviously the patient population was athletes post-op, and it involved a lot of neurocognitive load with physical tasking and psychosocial aspects in terms of like fear avoidance behavior in returning to sport for athletes coming out post injury. And my kind of question to you is how do you think that motivational interviewing would benefit athletes in terms of improving their mental toughness and basically improving their own self-perception post injury?
Yeah, I love this. Okay. So I think that people, again, I think that this is like just overlooked by me. I think it's overlooked, I'm sure, by a lot of providers. It like hurts me a little bit that I overlooked this for such a long time. Because it's not often until you really or you are able to evolve your relationships past the beginning stages of getting to know someone. Again, you're going to notice this more in your post-op population, because you're seeing them for longer. But the mental impact that long-term injuries have on players, it's people aren't going to show it to you. And what's crazy to me, is that I've started observing it more and more just throughout the continuum of care. So we see a ton of post-op ACLs. That's like that's my like specialty, if you will, is post-op ACLs. And we see so many people who the personality is completely different. Like the first like 1 to 6 weeks after surgery compared to after surgery. And I mean, like you get that kid back to sport and you just see like a difference. Like you see a difference in affect when you start to integrate sport specific stuff. Like you see a difference in affect when they start to be able to jog again. Typically to me, like where I start to see like a difference, is honestly like around the time when we get them up and starting to do more sport specific training stuff. So it's like past the 6-month mark, which is crazy, like that it takes that long for you to be able to see it. And like, it's honestly, I think what a really cool thing that Sanders Fit is able to like do for patients, and a lot of clinics around the country are able to do for people. But I think that what I really hope that like our clinic is able to offer, and like what the difference is that we treat people. It literally like almost brought a tear to my eye when a patient said this to me. She goes, "I feel like an athlete here, not a patient." And I like want it, like I literally have been like hustling. Like when you say like, have you been wearing a lot of hats? Yes, like I've been wearing a lot of hats. Like I'm trying to like preserve the culture of this thing, like as we grow it. Like when she said that, like I literally like almost teared up. I was like, that is like literally exactly my goal, is like the population, because of the setting. So we are inside of this really top tier premier sports performance center, high end. Like we see the best of the best, like not just professional athletes, like the best professional athletes that there are, like come and train here. Our physical therapy clinic is inside of that performance center. We share equipment. It's just a completely different, I joke that it's like my vibe is an elevated training room, but that's what I shoot for. And like not just elevated training room, but like I want people to like as soon as possible to feel like an athlete and not a patient. And you don't even have to relate it to athletes. You can just relate it. Someone told me this once, like I believe it was in PT school. They said there has to be a certain point where you're no longer a patient, but you're a person. And that's like the therapist treating them that way, but also the patient seeing themselves that way, is that they're not a patient, they're a person. They're not a patient, they're an athlete. And to me, like the faster that you can get people back into that mindset. So that's even like looking like single leg balance, you throwing a football back and forth. That's them doing wall sits. And at the same time that they're doing wall sits, they're doing something like with a dual cognitive tasking. Like they just, and for you to treat them, like for you to treat them that you're coaching them instead of you being their doctor, like you know that like there's like the rules, right? Like you need to make sure that like you're operating safely. You need to make sure that they're progressing toward their goals. You're testing objectively. All those things, like we know. But for you to treat people in a way where you're treating them like a person, not a patient, that you're treating them like an athlete, not a patient, it goes it goes deep, and like you get people, the buy-in is there, you get energy that's different. Like that's what people like say about our practice is like they're like the energy here is different, and that again it warms my heart because that's what I want. Like we want, and you just notice, like you notice when you're in an environment that sucks the life out of you. And I think that's what a lot of people get out of physical therapy. They go somewhere where like the energy is low and they're like, oh, like I feel like a patient, I whatever, which again isn't a big deal when you're only going there for like a finite period of time, right? Like ideal situation, you would go somewhere that positively impacts you. But if you're somewhere like going somewhere for a really long amount of time, like for these post-op ACLs, like right, like return to play is 9 months. Like that's what the evidence shows. And like 9 months of you going somewhere that builds you up or somewhere that takes from your cup. Like you want to be going somewhere that builds you up and builds your cup. And like I'm a huge, like this gets me fired up. Like you saying that like the flow is good. Like the flow is good because this gets us fired up. Like you guys are the same way. Like I can see it in y'all too. But like it's coaching. Like I think that you treat people like you know what you have to get done. But for you to present it into a patient in a way that like fuels them and fills their cup, like you talking about what they want to get back to, you talking about how their team is doing, like, hey, what are you doing in the weight room? Like you doing all these little things. Hey, are you eating well? Like all those little things, like people just like in general, like we have to care for people. Like that's what our goal is. That's what our role is. Like we do good things for people. We help people, like care about people, care about the whole person. It's like my soapbox is my thing, but like it gets me fired up because you're gonna get better outcomes. You're gonna get better. You're gonna be able to do what your job is better if you are able to connect with people at a deeper level. You're just going to. And to circle back into you talking about like the mental stamina of someone after an injury, like yeah, like how you treat someone is going to be a direct reflection of how they see their knee. If you treat their knee like their knee is made of steel and they're going to be able to like go back out and they're going to be able to do it because you prepared them super well to be able to go back to their sport, they're going to trust you. Like there's going to be some degree of like, oh, like is it all the way better? But like you treating them like it's made of steel like is going to impact them, especially those like more impressionable like younger kids. Like you have a huge impact, like more than you know. So yeah, I love that. I love that you went to that talk. I love that that's being talked about. I think it's really important, and I think that it's kind of on the back burner right now, but I think that like as time goes on that is going to become like more at like the forefront, like more talked about, because I think it's immeasurably important.
Yeah.
All the soft skills that we get or should have, it's like a prerequisite. You have to be able to build a relationship. And it's funny, even the limited number of patients that we've been able to see in clinic, the ones that you're able to, like when they greet you with a smile because you built a relationship, you already know the session's better than someone who's doesn't want to be there. And whether that's your fault or not, as a student, you don't know maybe, but the second you see someone who's excited to be there, you were better too. It's a two-way street.
But that exactly. I love that you said that. You're right. Yeah. You're going to be able to coach better. They're going to be able to receive it better. Yeah.
Yeah. Love what you all said. And I kind of want to circle back a little bit because your little story of your patient who said that they felt like an athlete. And I feel like it's important to be able to change the patient's mindset. And I almost feel like considering someone like as a patient, essentially, I feel like almost has a negative stigma in a way to a lot of like patients in that realm.
Yeah.
It feels almost like it's holding them back from feeling like a real person, and to reframe it to where they think that I'm an athlete, like I'm higher tier, I think could also promote that mental toughness and ultimately bring more buy-in for, I'm saying patients, even though I just said it almost feels like a stigma now, but for lack of a better term, for these athletes, let's just say that.
Yeah. I think that like it's okay, but I think it's okay because like we know at the end of the day, right, that it's a patient relationship. But when you're working with like super high level, high functioning people, it doesn't even have to be people that are like a professional athlete, if you will, but people that are really motivated and people that function at a high level, no matter what that is. So it can be workplace, right? but like people that are high performers, they want to be seen as, like, people in general like want to be seen as being capable, and like you being able to, like, you showing that you care, like what their goals are. Like, again, I'll bring it back to that, is like people don't want to waste their time. People don't want, like, they want direct correlation of like, hey, I came in today and we worked on, because I said, so like, say like you have, well, let's like bring it to like someone who works in a grocery store. I told them that like day one it hurt when I went to like lift this box off the floor. If the very first thing that you do when you see that person and you eval that person is watch them pick a box up off the floor, they're going to feel seen, right? They're going to feel heard, they're going to feel seen. And that's like a communication skill, not just like of a physical therapist, but that we all probably could be better at, like as humans, is like seeing people and being present with people. Like that, it goes a long way, because like for you to be able to break it down stepwise, and like that's like almost, I love the phrase of like working backwards. So work in reverse. So instead of you like starting out with like, oh, it's a 4 out of 5 knee extension manual muscle test. What if you worked backwards, and instead of you working toward goals, what if you worked from your goals? What if you worked from your long-term goal? So your long-term goal is they can lift 50 pounds from the ground 3 sets of 10 times to show that they're stronger. What if you worked backwards from that? And then you thought about your like thought process and treating that patient backwards. What about that? Like, you still know that you need to like work on knee extensors being stronger, but what are you going to be able to do to make it more similar to picking a box up off the ground? And again, that makes that patient feel so special. You're going to reach your goals faster. Insurance discharges them faster. It's a win-win on all sides.
I think that's a really good framework that we have not heard.
Yeah.
I think that, especially when you're coming into maybe a pathology you've never really worked with, and you don't have a huge background, or it's a sport that you don't know super well. And I was actually going to ask that, but I think we kept asking it. If you're going into something that you don't know super well, but they give you the movement that you're going to work towards, it gives you a much cleaner system rather than this wide net of catch-all that I hope I get to this point. I like that a lot. That's going to help. That's going to help young clinicians a lot, I think, is using the reverse mentality.
Yeah. Like, not to say like you still have to obviously test for things, but when you're trying to get there, exactly what you said, knowing where you want to get instead of like shooting broad and being like, I think I want to get to something. And don't let it intimidate you as a young clinician. Do not let it intimidate you if it's a obscure, or like, I don't want to say obscure, that's not the right word, but if it's a sport that you maybe aren't familiar with and you don't know the movement, have them show you the movement, or have them show you video of them doing the movement. Don't be like you being transparent with someone is going to build so much more respect versus you being like, them being like for me, I have a lot of dancers and I don't know dance. I'll be like straight with them. I'll be like, I don't know what that dance move is. Can you show me it? But you knowing, like you said, at initial eval, you having them show you a video of the movement that bothers them, don't pass over it. Like, just tell them, be straight up, be candid, be like, I don't know what that is. Help me. And they'll love that because they want to be helpful to you too.
I'm so excited to get back in the clinic now.
Yeah.
Let's go.
This break
It'll
is
be
too
good.
long.
Yeah.
I mean, you're still coaching though. You got a little taste.
Doing a little bit. Yeah, but it's not the same. Group fitness is fun. Group fitness is really, really fun, but it's not
the same as the one-on-one. You like the coaching. Yeah. You like the one-on-one. Yeah.
For sure. All right. Do you have any other questions, Vince?
No questions now. Got them all answered.
Ashely, do you have any questions for us?
I have questions. What are you guys doing next? What's the next move? Are you guys in clinicals at all now, or mostly classroom?
We got one more week of break, then we start. We've already done our comp exam. We'll do capstone, first year tutorial groups, and our electives. And we're both in the sport elective, which should be fun. We get to actually, as a class, pick one of our modules. So it'll be interesting what our class decides to do.
Yeah,
and
I'm
then,
interested to see.
Yeah. And then we're in clinic until we're done.
Nice.
I'll
Exciting.
be in ATI. I'll be with the Nuggets in spring.
Okay, sweet. Let's go. Yeah,
Yep.
Congratulations.
Thank you. And Vince, where are you at again?
I'm going to be at Concentra in Thornton, just outpatient MSK. And then I'm going to a sports facility in Hawaii for my last rotation.
Yes, amazing. That'll be awesome.
I'm excited for that one.
Yeah, super bummed for you about Hawaii. Wow, hard life.
Yeah.
Twist my arm, I'll go there.
Yeah. You're like, oh, fine, I'll go.
Not my first choice, but we'll
Tribute.
take it.
Yeah, it's fine. No big deal.
Yeah, take one for the team out there.
Yeah, for sure. I love it. Well, thank you guys so much for doing this. This has been really fun.
Thank you for coming on. Thank you for sharing your wisdom with us.
I try. I don't know about how wise I am, but I'll try.
You sounded.
I learned a lot.
Thanks.
I learned.
Thanks.
Now that you've been a first-time guest, if we have you on again, you'll be a recurring guest. When we have you on again.
So cool. So
recurring guest, Dr. Reichert.
All right, let's go. Let's go.
All righty, closing off Boxing Performance, episode 7. Take care, everyone. Until next time.
Yeah, thanks for watching.